Welcome everyone to today's webinar, RCM Digital Transformation Trends, What Execs Are Turning to in 2023. On behalf of Becker's Healthcare, thank you for joining us today. And with that, I am pleased to introduce today's speakers, Adar Palask, who is the Group Vice President of Clinical and Revenue Cycle Applications at Providence Health, and Jeff Becker, Vice President of Portfolio Marketing at FinThrive. Adar and Jeff, thank you for being here today, and I will now turn the floor over to you guys to get us started.
Great. Thank you, Cameron. And thank you, everybody. Thank you for joining us today. We're excited to present some of the research that we've conducted at FinThrive over the course of the last several months, and then really land that research with some boots on the ground perspectives from Adar at Providence so that we can really have an informed discussion on what's happening and where we're taking healthcare finances and industry moving forward. So to give you a brief overview of what we'll be covering today, we're going to ground this conversation in a broad overview of the healthcare industry landscape. What are the problems that are keeping healthcare financial executives up at night? And then we'll look into the research findings that we've prepared for you today. Top goals for health system RCM leaders, top technology investments that these organizations are planning to pursue to support those goals. How AI and automation are showing up across the revenue cycle management tech stack. And then we'll close with a session on what this all really means for our industry and for revenue cycle management leaders. So we'll start with just a high-level overview on where we are today in time and really ground this conversation in an industry landscape review. So it's no secret that healthcare is expensive in the United States. The cost of care for a typical U.S. family soars far above other industrialized nations. And today, medical debt is actually one of the leading causes of personal bankruptcy in the United States. And so when we think in terms of the cost of the care that we're receiving, it's important to look at the outcomes that we're realizing as a result of these expenditures. And so when we look to the outcomes broadly within our industry, what we see is year-over-year life expectancy reductions within the United States. The CDC reported that today we have a 76.4-year overall life expectancy. That's a 3-year drop from 2019. And this is a trend that predates even the pandemic. We've been watching life expectancy slip for years in the United States. And if you really wanted to go back to the last time in American history where we saw this kind of overall decrease in life expectancy, you'd have to go back more than 100 years to World War I and the Spanish flu pandemic before you'd see this kind of historical overall drop in life expectancy. So as a nation, I think it's important to frame the conversation around how are we working to correct this imbalance between the cost of care that's being provided and the overall outcomes that we're enjoying as a result of those expenses. Legislators, of course, as we all know, have stepped in with near perpetual healthcare reform efforts. These have largely focused on enabling consumerism, increasing access to insurance coverage, ensuring that medical data is portable and transportable, and enabling consumers with the tools that they need to take action in this market in the ways that consumers do, with the intent of driving down costs and increasing selection and therefore overall quality. But as we know, the perpetual reform that we've implemented as a country has failed to really move the lever, and we continue to lag behind. Our life expectancy falls far below global peers, and our overall per capita cost of care continues to climb. So in this overall market, what I think is really important to ask ourselves is how are the core stakeholders faring? The people that are driving care delivery, the patients that are receiving that care, how are they faring individually? And on the provider side of the spectrum, what we'll see is a truly historic financial pressure being placed on healthcare provider organizations today. Provider organizations are facing as much as 15 months of sustained negative margins. They're working to address these larger global issues driving healthcare improvement with truly negative margins. And so the overarching financial pressure that they are in results in a situation where their priorities really may become to course correct on short-term gains, to stabilize revenues, to invest in larger initiatives to improve some of these overall trends that we see in our data. And so it really becomes an inflection point where financial leaders need to create a vision, a foundational vision that's going to drive their organization through these large problems and set a course for something foundationally better for the industry and for their organizations. And as they navigate those landscapes, they're facing short-term headwinds that truly are strong. Sustained reduced visit volumes since pre-pandemic levels, continued staffing shortages that really got them of the ability to take processes to the next level and really start analyzing and incrementing their way towards improvement. And the end of the public health emergency, which is going to shift a whole host, potentially millions of patients off of their current insurance provider. So we understand both the short-term and the long-term financial pressures that our provider partners face as headwinds. How are patients faring in this market? When we look at what patients want from their healthcare experience, we see the same levers of consumerism that you'll see in many other industries. Patients want cost, quality, convenience. They want estimates of out-of-pocket costs. They want help locating nearby services. With a oversaturated ambulatory market that's characterized by increases in retail clinics, increases in urgent care clinics, and a large variety of care locations, patients need help finding care providers that are in network, that provide good care, that are easy to book appointments with, and they want modern digital payment options. So again, the way that patients are walking out their front door and selecting a provider is based on these core tenets of consumerism: quality, cost, convenience, and the ability to navigate our market more effectively. And there's an army of new entrants being heavily funded by VC firms to bring these kinds of organizations to fruition and truly compete for these visit volumes and these patient loyalty with a more frictionless digital front door and a virtual engagement model. One Medical is one example, a primary care first tech-enabled organization that raised over $500 million in venture capital before being acquired by Amazon. Oak Street Health is one that followed a similar model, raising $405 million in venture capital before being acquired by CVS. So there is an arms race to building the consumer experience that these patients are telling us that they want in order to capture that patient loyalty, build that digital front door to healthcare, and then ultimately steer those patients and help coordinate their care. So to bring this together, I think it really provides a solid overview on our larger issues that are driving digital transformation initiatives that are top of mind on a 10-year horizon for healthcare financial executives, and then brings that down to the more today and now. And what are the short-term issues and headwinds that these healthcare leaders are facing when they set that vision and set about executing and driving their organizations toward that end state. And then really what the market looks like and how competitors are stepping into this fray to start competing for that patient loyalty. So I think at this point, what I'd like to do is turn it over to Adar, and just if you could just give us a little bit of a sense of your view of the world and what your vision is for your organization as you navigate these challenges.
Sure. Thank you, Daniel. Predicting the exact future of healthcare systems is challenging, I think, as your slides laid out, but there are several trends that might shape the development over the next 10 years. Certainly what you mentioned, digital transformation, increasingly adopt digital technologies such as telemedicine, remote patient monitoring, obviously EMRs or electronic health records. This really could improve that access to care, enable a better patient to doctor communication. Personalized medicine. Advances in genomics and medical research will lead to more personalized treatments. Genetic testing and targeted therapies are becoming more common, allowing healthcare providers to really tailor their treatments to specific patient's genetic profile. AI and automation, you kind of hit on it. I think we're going to talk a little bit later about this, but artificial intelligence and that automation will really have the potential to revolutionize healthcare. Machine learning of algorithms can aid in diagnosis, help with drug discovery, treatment planning, etc. Preventative and predictive care. So there will be likely a bigger focus or a greater focus on that preventative care to identify risks early on. Wearable devices, I think all of us have some type of a wearable device these days, really could monitor things like vital signs and others to provide real-time feedback. I think you mentioned this as I believe you called them an army, but integrated healthcare. So collaboration with different vendors, groups, etc., to specialize in different areas, really to help put together that comprehensive care. And then finally, I truly believe there's going to be an increased emphasis on mental health, recognition and understanding of that mental health issues that have been growing. I think we've all seen it, and that healthcare systems such as Providence, we are going to prioritize mental health being even more. Improved access to mental health services and getting the ability for patients to be able to access those services is certainly going to be a key deliverable.
Very good. And when we talk to our customers, they'll tell us that the financial constraints that they're under today are really becoming a catalyst to more large-scale sweeping changes within the organization. Are you seeing that too within Providence?
We are. I mean, everything I just mentioned costs money, and it's very difficult to be able to implement. So you've got to look at different ways to figure out how you're going to become more efficient. A lot of these things that I just mentioned, if they don't result in efficiency and gains, it's very difficult to pay for them. We've all seen our costs are rising. Your slides are spot on, both employee costs as well as supply costs and drug costs. They're all increasing at a very fast pace.
Okay, so what I'm hearing is that emerging technology is bringing opportunities that should have a meaningful impact on some of the challenges that we face as an industry. But at the end of the day, health system financial leaders are going to be held accountable to funding that, paying for that, rolling that out, and making sure that there's a viable business model that sits underneath those new capabilities and care delivery models. So let's go ahead and move into some of the research that we're here to present to you all today. Over the course of between December 2022 and February 2023, we surveyed 86 healthcare financial leaders on their top overall organizational goals heading into 2023, the initiatives that they were planning to pursue those goals, the investments that they intended to make to pursue those goals. And we'll start to dig into that seat, the role of the healthcare financial leader and how their role is going to help bring about some of these changes that we're really seeing this moment as becoming a catalyst for that kind of change. And so when we look at the survey results, what we find is that by and large, increasing revenue has become the top priority for health system financial leaders. And it's really with no surprise. Healthcare organizations are operating under negative margins and have been for 15 months running consecutively now. And so it's fundamentally unsustainable for these organizations to really prioritize anything other than righting that ship. That is going to allow them to unlock investment dollars to support many of the other initiatives that we're looking at here. From there, they're looking at reducing costs. So there's, as Adar just laid out, there's ample opportunity to bring AI and automation and technologies to play to bring down the overall cost of healthcare delivery. And it's becoming critical, especially as we face a market that is so bogs down with staffing shortages that we bring those technologies to bear on broken or antiquated processes and help reduce those overall costs. Coming up next is improving the patient experience, which we know that there is room for improvement on improving the patient experience through partnerships, through implementing technologies, just through direct outreach to our patients and understanding and architecting a digital front door experience that is going to more directly align to the experiences that they're having in, frankly, the other industries that they are engaged with day in and day out. And the fourth priority there is managing staffing shortages. And so we've seen sort of an ebb and flow and prioritization of staffing shortages over the course of the last year. But the truth of the matter is that the staffing shortages didn't go away. The revenue deficiencies just increased in priority. But those staffing shortages are still there, and they're still a pressing problem for our health system leaders. So, Ed, how are you thinking about strategic prioritization at Providence this year?
Yeah, I mean, I think all your priorities were spot on. The increased revenue through diversifying services. As I mentioned, that could be a range of services that are emerging within healthcare, but offering new specialized treatments, new preventative care treatments, or investing in some type of an innovative technology or therapy. Also, telehealth, I think, will also help reduce some of those costs. It's been gaining a lot of traction, obviously, over because of COVID, really kind of sped that up. But the ability to improve access for patients, as well as reduce some of the costs of being on site, and then value-based care models. Definitely looking at a way to deliver that high-quality care. While controlling your costs, adopting those payment models that reward those positive patient outcomes, and emphasize those preventative measures. I think all of those are certainly areas that we're looking at in 2023.
Excellent. So let's take a deeper dive into some of the research and understand how others are pursuing these objectives and starting to make inroads into realizing gains on these. So the first that we'll look at is increasing revenue. So top overall planned initiatives to increase revenue. I think right out of the gate, what you'll notice is a operational audit of reducing denials, improving prior authorizations, improving coding accuracy, registration data accuracy, point of service collections. These are fundamentals of a healthy revenue cycle. And first and foremost, the health system leaders are telling us that they are going to clean up in-house operational processes to help drive revenue increases in 2023. These are clear-cut cases where they have the people, they have the process and the technology that they need to take immediate action in these areas. And so I think it comes to no surprise that those would rise to the surface. Of interest, I think, is that rounding up near the bottom of the list is funding new patient acquisition strategies. So traditionally, when you'll look at a health system and their approach to growing revenue, you'll see some of these quite a bit higher, establishing new facilities, expanding service lines, some of the things that moving into new geographies, some of the things that you would traditionally see as revenue growth strategies are really lower on the spectrum here. And rounding out the bottom of the list is value-based care participation. So it warms my heart to hear that Providence is bullish on value-based care participation. What we see here is it's relatively flat. Fewer reporting that this is a top strategy to increase revenue. Reducing adoption is relatively flat as well. So overarching respondents are saying that this isn't aligned to their revenue increase strategies. So we love to hear that that's something that you're pursuing at Providence. When we look at technology specifically, and what are the top bets health systems are funding in this climate of limited available capital, what we're seeing is denials management, underpayment recovery, electronic prior authorizations, things that really directly align to enabling those top-level process improvement areas that we looked at on the slide prior to this. 77% of the market is already leveraging some type of denials management solutions, but denials continue to climb. They've climbed 20% in the last 2 years. Overall, 11% of all claims are being denied. And there are opportunities for emerging technology to make a real impact here. And so that's what you're starting to see drive additional investment in an already saturated market. Predictive denials algorithms are helping uncover probable denials before they're submitted. Large language models like ChatGPT and others are stepping into the denials and appeals process to help write appeals letters and support clinicians in their needs to appeal denials on behalf of their organizations and their patients. Similarly to denials, underpayment recovery is an opportunity for automation, an opportunity for advanced analytics to get to the heart of what was the root cause of that denial, what's the appropriate next step for our organization. Underpayments are, like denials, continuing to grow. And so today we're seeing between 7 and 11% of claims being returned underpaid. And as payers become more aggressive about underpayments and then also about takebacks, we're seeing a significant uptick on the provider side of our industry in leveraging RPA and AI to ensure that the care that is being delivered is being appropriately reimbursed as per the contract terms. And then last is electronic prior authorization. This is the #1 overall investment area for 2023. We see this show up in top technology bets to increase revenue, to reduce costs, to managing staffing shortages. Electronic prior authorizations is seen as an area that's going to have an impact across a number of different top organizational goals. And the reality is that there's relatively low adoption of true electronic prior authorization solutions that support determining whether a prior authorization is needed, helping front office staff collect together the information that's needed for that prior authorization submittal, helping ensure that all of the right codes are entered onto the prior authorization, and then helping facilitate the submission and the status checking of that prior authorization. And so emerging solutions are stepping into this problem area and really helping curb both the manual labor and the downstream prior authorization related denials that health systems are seeing today. Sodar, take us down a layer into Providence. How are you all tooling up and strategizing for revenue growth in 2023?
I mean, I think you kind of just answered my question. I mean, all of those things are certainly investments that we are looking at. I mean, these are things that you can do right now. These are tools that you already have in many cases, or can, for example, the electronic prior auth comes with many EMRs now, or is integrated, whereas years ago it was a separate product. Now they're either partnered or integrated in some fashion with the electronic record. So it's part of the workflow, so that you can really take a stronger stance there. Again, the denials management, as I mentioned earlier, tools and AI and other things that can predict those types of things. That's exactly what we're trying to implement as well. Trying to get ahead of the curve, not be behind. It's very, very difficult, I think, as many people would know, to try and go back and start trying to collect that. If you can predict where you might be denied, that's where you can put a little bit of your very scarce resources, where you can start focusing those resources and ensure that you don't have that type of denial. So those were certainly the top areas that Providence is also investing in and spending a lot of our time here in 2023.
Excellent. So let's turn our focus then to cost reductions. Not surprisingly, top of the list here is improving the overall prior authorization process. I think we covered in the last slide that 6% of prior authorizations are initially denied, and the vast majority of those denials are never appealed. And so there's opportunity to support frontline workers on the manual effort that goes into identifying whether a prior authorization is needed and getting all the various pieces of information together, submitted over to the payer. And so there is emerging capabilities within the electronic prior authorization market that's enabling these workflows for providers to shift this from a fully manual to a partially manual to a fully electronic and automated process. Beyond this, we're looking at a secondary shift to reduce administrative burden on staff, and that comes in two forms. One is through implementation of RPA, overall automation technologies. There are a host of new solutions landing in the market, not only pure RPA bots, but also solutions to help organizations uncover what processes lend well, what are those high volume, low complexity processes within your revenue cycle that lend well to automation use cases. But then the other area where we're seeing a lot of investment in alleviating, reducing costs is shifting some of this work to self-service models for patients, virtual check-in capabilities, self-scheduling capabilities. So deploying self-service tools for patients to alleviate some of that burden on front office staff. And then third is lives with contracts themselves, vendor consolidation. And I had mentioned earlier that prior authorization can now be embedded within EHR workflow in many cases, or integrated into EHR workflows from vendors that support that capability. And so really looking at leveraging EHR capabilities where you can, consolidating RCM technology vendors to platform vendors or larger vendors that can bundle a majority of the RCM use cases into a single contract. It's fewer data feeds to manage, it's fewer contracts to negotiate, it's fewer invoices to manage. So a moderate push to move from bringing these technologies in through a variety of point solutions to bringing these new technologies in by leveraging your EHR vendor, or secondary to that, leveraging an RCM platform provider that can bring some of these capabilities under a single contract. When we look at cost reduction technology bets, RPA jumps to the front. We're seeing a large focus and interest in understanding how RPA can be used within revenue cycle, specifically what processes the revenue cycle lends well to, RPA lends well to within revenue cycle, and then finding vendors that can truly deliver on the value that we all see in RPA. Remittance management solutions, as well as a heavy administrative burden on remittance management and remittance matching in back office staff. And there are emerging capabilities that can alleviate and auto match much of the remittance workload for back office staff. So this is seen as a low hanging fruit area for cost reduction and reduction of overall manual effort. And then end-to-end RCM platform providers, another emerging space within the market where organizations are really starting to look for my EHR vendor and my RCM vendor and looking at these as platform decisions versus a EHR vendor in a host of point solutions. And so as these RCM platform vendors really take shape and begin to support workflow from front, middle, and back office revenue recovery workflows, there's increased demand to consolidate vendors and bring in a platform play that maybe offers some differentiated features like analytics. So bringing it back to Providence, and how's your organization approaching cost reduction this year?
Yeah, I mean, operational efficiency is number one, and it's not just clinical, but it's revenue cycle. As you mentioned, looking at opportunities to automate processes that have always traditionally been manual. That not only frees up hopefully errors that are occurring, but frees up staff that can be used to help with more complex tasks. It is certainly an area that has been a focus for Providence, as well as the self-service. So putting a lot of the data entry, so whether it's demographics, insurance information, your allergy information, things that patients know, and being able to put those into the systems themselves versus filling out traditionally you would go into the waiting room and get a big pad of paper and you'd have to fill all that information out, and then someone still has to manually type all that information out. That's not operationally efficient. So looking at those tools and those opportunities, as well as the scheduling. Again, getting away from just the phone call to the office to schedule an appointment, but instead be able to have self-service and be able to go onto the web, be able to schedule your own visit, put in your own information, your own insurance as well, is certainly an area of focus for Providence. And then finally, again, is the consolidation of, as you mentioned, of many different vendors. We've had a lot of niche vendors that would come in as you're looking for an end-to-end process improvement. Is very difficult to do that when you have a bunch of different vendors in there. So consolidating, looking at one vendor or two vendors to be able to do it, and fully leveraging what those vendors can do and their capabilities to be able to take advantage of that. Again, not only does it reduce the cost of contracts, et cetera, and maintenance that staff have to do, but also you can usually take advantage of more opportunities with limited vendors.
Great. So I think that aligns pretty directly to what we're seeing in the data as well, and it's nice to hear that. The next top planned overall initiative for healthcare leaders is patient experience. And we talked about the impetus to meet patients where they are, to match the digital experiences that they're having in other industries, and to help enable and inform patients as they're navigating our local healthcare markets and seeking care. And so a lot of what you just talked through will show up here as well. The desire for patients to take on more of this work in a self-service model. So it really does become a win-win between a cost reduction initiative and a patient experience initiative when we start empowering and enabling patients with more of these self-service tools. So when we look at the overall planned initiatives to improve patient experience, we'll see quite a bit of self-service tools right up front, improving the scheduling experience, improving the payment experience, improving payment estimation accuracy. Estimation accuracy is becoming a big driver in vendor selection in our world, in really being able to differentiate payment estimation modules based on how accurate that payment is as compared to the final bill. And I think that really speaks to the maturity of the space and puts the patient at the center of the purchasing decision, which obviously we love. From here, health systems are doubling down on leveraging native EHR capabilities in the patient experience front as well, looking at patient portals, looking at patient-facing capabilities that EHR vendors are deploying, and ensuring that those are being utilized to the maximum of their ability, and patients are being educated on how to access those, how to utilize those tools to help drive some of these capabilities out into the patient population. And then last is virtual intake technology. There's a significant uptick in overall interest in buying activity in virtual intake technology, helping patients with this. Really rose to prominence during the pandemic, but was certainly around before the pandemic. And we all get text message reminders of our upcoming appointments, and in some cases that has the ability to allow us to reschedule that appointment or cancel that appointment right through our SMS text message. And those capabilities have evolved and are really allowing healthcare systems to walk patients through the full financial clearance process digitally, pre-visit, and moving much more of that pre-visit workload over to the patients ahead of their scheduled appointments. And so when we look at top technology investments planned to improve patient experience, number one is patient estimation capabilities. And as we're looking at good faith estimates and No Surprises Act legislation get hammered out and exactly what the future of that's going to look like, many health systems are starting to look at their patient estimation vendors, understand what their roadmap looks like for supporting those implementation of some of those regulatory requirements, and really looking at what their EHR vendors offer, what the other vendors in the market offer. And this is a leading driver for organizations moving to RCM platform plays, or even in some cases point solutions. Virtual intake solutions comes in at number two. There's very low adoption of virtual intake solutions in the markets today, and there's a really established business case for, as we had said, both improving the patient experience and reducing cost by allowing patients to engage with a virtual intake solution rather than managing all of that intake work at the front desk. And then patient payment solutions, having another win-win space here, having an impact on point of service collections, but also providing patients that modern digital payment experience that they're telling us time and time again that they are interested in. So how about at Providence, Adar? How are you looking at patient experience?
And I mentioned a few of them already with the virtual check-in, but again, it's those digital health tools, expanding that access to patients so that they get the care when they need it and how they need it. And that goes to the personalized care. I think that's a big focus for us in 2023, trying to address all the needs of the patients, enhancing our communication with our patients through, as you mentioned, patient estimates, putting out there so there are no surprises. Allowing the patients to electronically create payment plans as opposed to having to call and schedule a time, et cetera, but to be able to try and do it electronically through our portal tool. And all this is done through continuous feedback and improvement. We want to make sure we're hearing from our patients understanding what's working, what's not working, and be able to be agile on the fly to be able to adjust tools that aren't making sense to them, that we can very quickly make those adjustments so they do make sense to our patients and then they can take advantage of them.
Very good. So managing staffing shortages comes up fourth, and that's the last area that we're going to sort of take a deep dive focus on. So staffing shortages is one of those problems that at various times when we survey, we'll see this as a number 1 or number 2 problem, a number 3 or number 4 problem. And it's not a problem that goes away. It's just a problem that its importance in relation to some of these other more pressing issues as we deal with economic uncertainty tends to jump up and down in overall prioritization. So when we look at top planned initiatives for managing staffing shortages, top bets are really keeping staff happy and in place, and improving their overall satisfaction and their engagement. So keeping the staff that you have really is top priority for managing staffing shortages. These employees and colleagues know their processes, they know their workflows, they know their job. They don't need to be trained. You don't need to incur the cost of recruitment. So really the top bet for managing staffing shortages is to work with your staff to keep your staff. From here, it's alleviating some of the administrative burden with across the revenue cycle with low-hanging fruit, high volume, low complexity workflows, and starting to carve out some of the work that your staff is, some of the hours that your staff is spending on those, so you can redeploy them to more rewarding and high value work areas. Cross-functional training. So we've seen quite a bit of redeployment of RCM staff to adjacent function areas, as RPA capabilities eliminate the need, and B, as staffing shortages create demand for added FTEs in other areas. So bringing in capabilities to enable cross-training of your RCM staff on adjacent functionality, adjacent processes and workflows has become a top of mind priority as well. And then lower on the list is outsourcing RCM functions. So there's a high premium on a decision to outsource. And so as organizations are balancing the needs of their staffing and their needs to increase revenue and reduce costs, you're seeing outsourcing strategies drop lower in the prioritization list and much more focus on enabling the organization's employees, keeping up retention rates, leveraging emerging technology to streamline their workflows, cross-training them on adjacent function areas. So to probably no one's surprise here, robotic process automation shows up top of mind for managing staffing shortages as well. There is ample manual workflow in revenue cycle management, and we all know that the tedium of working through manual, low-value tasks can be frustrating, and that we want to work for organizations that are proactively identifying those workflow pain points and bringing technology in to support us. And so robotic process automation does just that. It allows us to get more done with fewer people and removes some of those frustration points from colleague workflow. Virtual intake solutions is number 2, and I think we talked a good bit about why this is a win-win area for cost reductions and improving the patient experience, but this also has an immediate impact on front office workforce and allowing organizations to move more of that pre-visit intake and patient financial clearance into a self-service model to help front office staff manage that workload volume with less people. And then billing and coding reference libraries is an interesting one, and it aligns really nicely with the initiative to cross-train RCM professionals across adjacent functions. Integrating billing and coding reference libraries and educational tools and knowledge tools into your organizations really creates a self-service support area for teams that have been recently redeployed to newer adjacent function areas. And so, when we look at staffing shortages at Providence, is that an issue that you're facing as well? And what are you doing about that?
I think it's an issue that's everyone is facing. I don't know any organization that isn't facing any type of a workforce shortage. Many of the stuff that you mentioned is what we're doing. So workforce planning, we're investing in our strategic workforce planning and to anticipate any staffing needs or mitigate any shortages. Recruitment and retention, just like you mentioned, trying to the amount of money that you spend to retrain somebody, especially on some of these complex EHRs that folks are using or RCM systems that they're using. They have to get certified. It takes them months. That's a huge investment. So targeted recruitment efforts. How do we make sure that folks feel like they are valued? Make sure that we have a well-being program that recognizes the importance of the employee well-being, so that we can prioritize strategies to be able to support our staff members. So we aren't having to go back and re-recruit and repay and retrain very, very skilled staff. Utilization, as you mentioned, of the tools. We've talked about it over and over again, but the RPM, the RPA, the AI, stuff like that, that can remove those repetitive tasks over and over again, so that folks can focus more on the advanced work that many of those staff that we have here at Providence really want to dive into, as opposed to those manual entry work that's being done. So spot on, very much an area of focus for Providence in 2023.
Well, it makes sense. So when we think of digital transformation more broadly, I think what comes top of mind is AI and automation across many of these point solutions. We've talked a lot about the role that self-service plays. It's an overlooked area of opportunity, but AI and automation really represent the heart of how health systems are approaching RCM digital transformation initiatives. When we look at the use of AI in healthcare organizations, you'll see clinical decision support has the largest overall adoption, as well as AI in clinical dictation and transcription with NLP speech to text. You're also seeing adoption of AI in medical image interpretation. I think that's an area that we're all following very closely. But there are additional planned uses, and that's really where things become more interesting. The second highest planned use of AI is directly within revenue cycle management. And there is a whole host of different kinds of technologies that are landing within revenue cycle management, from machine learning to speech to text to natural language understanding, computer vision, chatbots, RPA. Taken collectively as tools in our toolbox, we can make meaningful improvements to some of the processes that are currently in place across RCM. So I thought what would be interesting would be to really step back and just talk through the concept of intelligent automation and what that means. The idea of using multiple tools from this toolbox to solve one process wholly. So the problem that we can look at is insurance discovery solutions. On the back end, insurance discovery solutions uncover unidentified insurance for or identify previously unidentified insurance for patients. And these generally return in a work list. And most health systems aren't staffed to rebill all of the found coverage that comes back from these insurance discovery tools. So how can we maximize reimbursement for health systems and reduce overall costs and alleviate staffing shortage with this collection of emerging tools? Well, the first thing that you'll find is that automation is an excellent tool to move through these work lists and auto rebill low complexity returned coverage, where it doesn't require a human in the loop, and we can step right in and allow RPA to run through that found coverage and automate the rebill process. But that does still leave some coverage that your staff is going to need to work. And so in that case, what you'll see is adoption of artificial intelligence and machine learning in particular in this case to start understanding which coverage is the right coverage for my team to focus on, not just sorting that found coverage by traditionally what you'd see is that found coverage would be sorted by the value of the claim, just the dollar value of the claim. Work the high value claims first and then work your way down. It's an intuitive and logical approach to sorting a work list of that nature. But with machine learning and intelligent work list prioritization, what you'll actually be benefiting from is a work list prioritized on value of the claim and probability that that claim is going to result in reimbursement. And when you do that, what you'll see is a significant increase in overall collections from your Insurance Discover work lists. This way, your staff is prioritizing and focusing their efforts on work that's going to realize value for your organization. And the coverage that's not worked is coverage that has a low probability of being reimbursed. And so it's with this sort of 1-2 punch between RPA and machine learning in this case that you can really make meaningful improvements that you wouldn't be able to make with just RPA alone or just AI alone. So when we surveyed the healthcare financial leaders on overall AI and RPA use cases in revenue cycle management, the 3 top priority must-have capabilities that they were investing in were prior authorization, both status monitoring and automated prior authorization determination, meaning is a prior authorization needed for this visit, and then automated remittance matching, both high friction areas within revenue cycle that today in time are largely managed manually, and where there is real opportunity for these repeated processes to be tackled with AI and automation taken collectively. Are there any thoughts on AI prioritization at Providence? Anything you're particularly excited about?
I mean, I think you hit on one of the top ones, and really is the automation of reversal of our adjustments, those types of things, in the work in the work queues. In an automated way instead of a manual way and waiting for someone to be able to go and look at those denials. But another area that actually is pretty exciting that we are looking at is inpatient guidance, so automated inpatient guidance. So at the time that a provider is putting in their diagnosis code and putting in their documentation, is there a way that you can use AI to be able to help that provider choose the correct diagnosis? And so it's an exciting new area. Obviously, it's very data heavy. It's still an area that's being researched, but again, a lot of that's done on the back end. We've talked about this entire presentation about the ways in which we can automate some of these processes, and so we're pretty excited to be able to look at some of that inpatient guidance automation.
Excellent. I love that. And so the elephant in the room, really, what we need to cover in any conversation about digital transformation, RPM, is the rise of large language models like ChatGPT and Google's MedPalm. Large language models have an opportunity to shift processes and workflows across truly all industries. And there are opportunities within healthcare and within revenue cycles specifically that we're seeing some of these early use cases of deployed large language models, answering basic patient questions in the pre-visit space, even regarding insurance coverage is an early opportunity for a ChatGPT-like large language model deployment, drafting, pre-authorization, and appeals letters is another area. Anywhere where you're drafting letters is a great opportunity for experimentation with large language models. And then one thing that is lesser known, but ChatGPT and these large language models do a really nice job converting natural text queries to SQL queries that can shift some of the reporting requirements out of an IT support function and into a self-service model. So even internally within the organization, to allow organizations to data dive and slice or dicer or whatever your enterprise data warehouse is in a more self-service model, using something like ChatGPT to convert that query into an executable SQL code set. Anything you're seeing at Providence, Eder?
Yeah, I mean, I think the idea of having a chat bot, certainly something that's on all of our websites, and to be able to have patients ask those questions. And again, with ChatGPT, you could get into some really complex questions that they might be able to answer, whether it's about their care, their bill, et cetera, that normally would have, get the standard, I can't answer that question out of a bot, and it has to go to a live person. So I think there are tremendous opportunities both on the revenue cycle side as well as the clinical side. It's got to be measurable. It's got to be safe. And so I think that Providence, like many others, are dipping our toe into that realm and seeing what works.
Very good. So to bring it all home, what it means. First and foremost, we started this session talking more broadly about the industry and where we sit today in time. And what we're hearing more and more from healthcare finance leaders is that they are stepping into disruption. The financial landscape and sustained negative margins and sustained reduced patient visit volumes and an increasingly saturated ambulatory market with new entrants that are using technology to compete for patient loyalty. These are all elements that are driving fundamentally different visions for how healthcare financial leaders are helping navigate and strategically guide their organizations. So if you're a healthcare financial leader, I would challenge you to step into disruption, to embrace disruption, and to use this as a catalyst to make meaningful change within your organization. New market entrants are competing for patient loyalty with better digital experiences. It's well understood what patients and consumers in general want from a functional market, and there are heavily funded emerging provider organizations that are bringing these capabilities to market. So understanding who's operating in your market, the capabilities that they're bringing to market, and ensuring that you're maintaining momentum and digital maturity with those organizations is critical. Self-service patient tools are seen as a win-win and are poised for rapid adoption. We've talked about this throughout this presentation. There's so much focus on AI and automation as digital transformation levers, but the third lesser spoken about capability is self-service as a function, shifting some of the manual labor that your teams are doing into a self-service model for patients is seen as a benefit to patients. It's seen as delivering on a more mature digital experience for them. And it is something that supports your internal goals of reducing costs and managing staffing shortages. Overall, AI, RPA, and RCM platforms themselves are seen as the quickest path to restoring profitability. We saw this with RPA over and over. We saw this with RCM platforms, moving to fewer vendors and vendors that are truly strategic partners with you and not just bolt-on point solution vendors for you, and creating a partnership structure that allows you to work with an organization to carve your path forward and have take a strategic approach to digitally transforming your revenue cycle. And then last, large language models. They will dramatically improve specific pain points, but in and of themselves, they will not transform RCM alone. This is yet another tool in our toolbox. We talked about machine learning. We talked about RPA. We talked about computer vision and NLP. Large language models fits right into this perspective of a tool in the toolbox that we can use to start tackling complex processes. Are there any thoughts to add here?
No, I think you summarized it all well. I mean, there's a lot going on. It's a very complex space, but the one thing I will add is that it's about speed. Things can't take 10 years to develop. These are solutions or plans that folks need to put into place now in 2023, not something for 2026, 2027.
Very good. Okay, so at this point, I think we can go ahead and open it up to the audience and start fielding some questions.
Sounds great. Thank you, Dar and Jeff, for a great presentation today. Like Jeff said, we have a couple minutes here for the Q&A session. You can submit any questions you have by typing them into that Q&A box that you see on your console. Just the first question that I see in the box is just about, I guess, the time frame of when these leaders were surveyed. I know you touched on briefly at the start, but for the people that came in just a couple minutes late, what was the time frame?
The survey window for this study was December of 2022 through February of 2023.
Great. And then just the next question, how does reducing vendors for cost controls affect group purchasing organization, impact operation cost, and inventory management?
Okay, so I'll restate that question. I think what I'm hearing is, are group purchasing organizations prioritizing vendor consolidation, or are they aiming to maintain a large inventory for their customers to select from? And what we're actually finding is that, I come from FinThrive. We are our RCM platform provider, and we do sell directly into group purchasing organizations. There's demand on the buyer side for group purchasing organizations, and so they're very attuned to what their buyers want. They want simplification. They want the vendor consolidation that imperative in the buyer's side of their business does drive them to look at RCM platforms and other larger vendor consolidation strategies. So that's a bright spot for us.
Great. Thanks for going into a little more detail on that one. Next question I see is, my health system is prioritizing denials management over all other initiatives this year. Does denials show up as a major objective in this research? I know, Jeff, you talked about kind of the climbing denial claims and stuff like that.
Yeah, so we look at denials management as an initiative, and that's how we study that. The objective that it'll start showing up under is increasing revenue and reducing costs. Denials management is actually the number one initiative that health systems are prioritizing to increase revenue. And so expanding denials management capabilities is the number one technology investment in the overarching investments and initiatives underlying the increased revenue goal. So you're not alone. There's a large effort to rein in denials, deploy more intelligent capabilities around denials, denials root cause identification, appeals management. There's opportunities for predictive modeling and RPA across all of those processes.
Great. And then there's a question about kind of the resources available after the webinar is over. If the slide deck that you guys went through is going to be available after the call.
Yes, absolutely. The slide deck can be made available. The presentation is also being recorded, and that can be made available. And we are imminently going to be publishing a report outlining the findings that we went through on this call today, and then going a bit deeper in some of the other areas as well. So you can look forward to all of that in the coming weeks.
Great. The next question, I think we probably have time for one more question here. How can we address the frontline staffing shortage in healthcare?
I think it's a fair question. So, Ed, do you want to take that one? I would prefer to.
No, go ahead. I mean, I'll just add our 2 cents. I mean, I think it's really a focus on the employee themselves, their well-being. I can't emphasize how important that is, making sure that we prioritize our strategies to be able to support and care for our front end caregivers, and whether it's a work-life balance, mental health resources, an employee assistant program, and some initiatives to reduce that burnout and compassion fatigue. Really need to focus on not losing the employees that we have.
Gotcha. Thanks for going into depth a little bit on that one. Want to thank Adar and Jeff for an excellent presentation today, and FinThrive for sponsoring the webinar.